I've been wondering how to start this, and I'll start where Sunny stopped. I think it's a good place, around HIV, because I think my leadership journey actually started in Durban in South Africa in 2000. You know, I was 4 years out of medical school, determined to pursue a career in surgery and developing myself along those lines. I was planning to go to the US at the time, taking the USMLE exams. They take a while. I registered to do a master's in public health on the side. Through that master's, I did a project. That project took me to looking to where to send an abstract for a conference. I sent an abstract for the thesis work I did to the International Conference on AIDS. I was surprised it was accepted. When it was, I looked for funds from family and friends, as we do, to go to this conference on AIDS in South Africa. And I don't know if anyone in this room was in Durban in 2000, but it was as an African, it was a heart-wrenching experience. At the time, there were already millions of Africans living with HIV on the continent. At the beginning of the conference, I was sat on the first row, and I listened to a South African judge, Judge Cameron, deliver the Jonathan Mann lecture. He spoke about his personal experience at the time. As a judge in South Africa, he could afford the $10,000 it cost to treat an individual living with HIV at that time. He spent his entire salary treating himself. And he spoke about his dilemma of living in a country where there were millions of people living with HIV, and just because he could afford it, he was able to afford the cost and the price of life itself. At that time, conventional wisdom was that it would never be possible to treat people with HIV on the continent. Treatment cost $10,000 per person per year. And, you know, the theme of that conference was break the silence, because this narrative wasn't actually fairly well known. But from that conference, a movement emerged, a movement that carried me along into a career into public health, that change is possible, that you can reduce the treatment costs to individuals from $10,000 to below $100,000. The next conference 2 years later was themed, the big slogan then was 3 by 5, to get 3 million people globally on treatment for HIV by the year 2005. And through that movement, the whole narrative of HIV changed. And so why do I bring this back to leadership? I think the biggest challenge we have as leaders is to challenge this ingrained preposition in us that change is not possible. That change in a public health parastatal is just not possible. You know, there's a lack of confidence in government, there's a lack of confidence in public health, in public parastatals. And even within our teams, I don't know what the experience of my other colleagues have been, but I'm told that this is the way we do it. This is how it's done. And there's a general pessimism about how and if we can change public health, public parastatals. And I think that's something I've been trying to fight, and I know my colleagues and brothers in the other parastatals are facing similar challenges and are trying in their own way to fight their own battles to turn this perception around. And then that now links me to my top 3 priorities. I've grouped them in 3 areas. Firstly is around the diseases that we are faced with. There are so many diseases around, and we've got to prioritize. We've prioritized 5, and we have been forced into this prioritization, not because we it needed too much work to be done. But these are things that we're faced with day to day. The first one is around Lassa fever and the group of viral hemorrhagic fevers, learning from the Ebola outbreak and be sure that we have the capacity to deal with this. The second is around meningitis. We're all privy to what is happening in the country at the moment. We've received a lot of criticism, I think fair, on why we keep having these epidemics that we know will come, and yet we seem so unprepared. The third is around cholera. This is another disease that for some reason doesn't arouse enough anger in our people. And I think that's because it predominantly affects a certain cadre in society who don't have as much access to the means of communication. The fourth is measles. It's incredible that children still die of a disease like measles in Nigeria in 2017. A disease that we've had a vaccine for 50 years, that is virtually free in every public health facility. And the fifth one is around antimicrobial resistance. Antimicrobial resistance, to me, feels a little bit like AIDS in 1990, where we see a big ship that is coming towards us, and somehow we think it will pass. And therefore, we hold ourselves back from engaging with this big issue. So that basically is one big group of priorities. The second big group is restoring confidence with our partners. You see, we've gone through an era where, at least within NCDC, I came to find, I think the best term for it is social distancing. That we had almost been isolated in our work, and therefore, in a way, lost the confidence in the broader community with whom we would normally work in the areas that we're challenged to work on. And so over the past 8-9 months, we've been working very hard to rebuild this confidence, give the reassurance to all our partners that, listen, we're on this journey together, and we will do what it takes to ensure that we achieve our goals together. Now, the third big area, and actually it links to the last question, is to introduce a sense of accountability into the work we do. Last night, like we've done every week over the past 6 weeks, we uploaded on the NCDC website a detailed situation report on the meningitis outbreak in Nigeria. We have made a commitment not to hide anything. We will be completely transparent with where we are with the outbreak and what our response is, whether it's going well or it's not going well. We are not going to embellish the figures. We are not going to make it nicer than it appears. We will put that information out there so that you can hold us accountable. And not just NCDC, because the responsibility for the work we're doing doesn't lie with one parastatal. Our role a little bit is tying together the knots of the entire health sector's response to diseases. You see, you can't have an effective NCDC without an effective primary health care system. It's just not possible. Think about meningitis. Who will take the CSF samples from the patients? Who will organize the specimen coming to the lab? Who will do the testing? None of that is the responsibility of NCDC. So we are all interdependent, and our role is to help organize the sector's response to prevent, detect, and respond. Do the small bits that lie directly in our responsibility. Hold ourselves accountable for those small bits, both in putting the numbers out there and in sharing that and making it accessible. It's not just about having the numbers in a PDF file somewhere in someone's laptop. We will put them out there. We're just starting with meningitis. We will do the same with all the diseases that we're working on so that you can see and judge for yourself. On the final point around accountability, accountability has been reduced a little bit in our context at the moment to shouting when things go wrong. And that is an important piece of the work, and a bit of what the Nigeria Health Watch Group does, and is very important. But just like Sani ended, just like Dr. Aliyu ended, all together as a society, we must decide on what premium we put on health and on parastatals like NCDC. The budget of the federal government is available to all of us. It's online. You can look for the line item for NCDC, and you can then decide on if enough emphasis is being placed on the institution to which you rely on for support, for action, for response when there's an outbreak. And if you don't hold ourselves accountable, if we don't vote in government that will prioritize health, if we don't hold our own leaders accountable to invest in health, then we really don't have the moral basis to come and shout about NCDC not delivering on a mandate. It's like shouting at a kid for not going to school when you haven't paid his school fees. So I think there's a broader context to accountability that I'm urging you as stakeholders in the health sector to take some responsibility for. And in a way, we are all leaders in that respect. This is not something that any of us should be fighting for on our own. This is something that I think we all need to fight for. If we want people to be treated, if we want people that are HIV positive to have access to treatment, we have to prioritize it. We have to say that our government has to pay for it. We can't insist on stuff that we're not ready to put money on the table for. If we want an NCDC that will fight for Nigerians to prevent diseases, to have the capacity to respond, we must invest in it. And all of us are leaders in that respect. And that's the responsibility I leave with you today at my last words, that we are on our part, ready, willing, and able to build a strong NCDC to serve this country and to take it into the future. But we need your support on that journey. We need you to be advocates for the work we do, all together collectively in the parastatals and our parent ministry. We need you to stand up and advocate for the resources and the space that we need to do our jobs effectively. So thank you very much again for this opportunity, and I look forward to a vibrant conversation after this.